All right, so thank you all, and again, thanks to Congressman Doggett. And so I just want to quickly present some of the findings, and then I know that Ron Brownstein will be here shortly, so I will go through these pretty quickly. But just wanted to talk a little bit about some of the issues here that we have found. So first of all, again, if people want to tweet anything about today's event, as Investing Kids is the hashtag. So the children's budget book really looks at 180 investments, and we look at all the various issues across all the in all the appropriations bills. And there's a 5-year look back. So what you'll find in there is a 5-year projection. Look back in terms of where spending has gone. And it's also based, we also look at it in real dollars and nominal. So we look at inflation adjusted. So there's columns out for every single program, so you can, it's a resource. And if you have any questions about it, please feel free to contact us, and we're happy. And if you want extra books, we have plenty of books, and I'm happy to get them to you for whatever purposes you need them for. So the key thing is that the kid spending is now about 8% of the federal budget. So, and it's declined. We're at a high of near 9%, and so there has been a decline over the time that we've been working on the book. In terms of the last since 2010, what we found is that the share of spending in the federal budget has declined by 6%. So it was about at 8.5 in 2010 and has now dropped to about 8% in total. And if you look at the president's budget, in every single year, he's proposed budgets that actually increase the share of spending for kids, except this year. Actually, and because of the restraints that are on him, and the budget, actually this year, his budget would actually have it go down to 7.9. So we're in a fiscal straitjacket for kids, and the long-term look projections for it are not good. In terms of the actual dollar amounts, what this shows is that the funding has dropped by $13 billion, or 6% since 2010. These charts did not convert very well. The funding for children, adjusting for inflation, I think the share has dropped by about 12% over time. Is that right? Is that right, Jared? Because that's fallen off the chart here. So anyway, in terms of the discretionary spending, it is still below that in 2010s, as you can see. So the number today is about $79 billion, and in 2010 it was $80 billion. So you can see the effect in the last year of the restoration and the work that people like Senator Murray and others have done in terms of getting rid of the sequestration, or almost eliminating it at all. And you can see the important effect that has had. So it's moving us back toward, but we're still below where we were in 2010. In addition, if you think about it in terms of an inflation-adjusted effect, discretionary spending is still down over 9% from where it was in 2010 for kids. On some specific issues around, I'll talk about 2 specific issues in the book, but they're all in there. So if whatever your interest is. But what I wanted to point out is in terms of where sort of conservatives are, in the Tea Party, we actually, in our poll we asked people if they were Tea Party supporters, and what you can see is that Tea Party supporters actually oppose cutting funding from children's programs. And so we asked people if deficit was very important to them, and we asked them if they were Tea Party supporters. If they said yes to both of those questions, then we asked them, to reduce the federal deficit, do you support cutting this program? And you can see overwhelming strong support for disapproving of cutting children's programs. You can see number 1 among those for Tea Party supporters is preventing child abuse and neglect. They do not believe we should be cutting programs and spending for child abuse and neglect programs. In addition, if you look at moderates and moderate to conservative voters, education is the number 1 issue that they believe we should not be cutting. And in fact, you can see that education beats Medicare and Social Security even. So what are we doing? First of all, on the child welfare issue. So we have Tea Party people saying don't cut it, but the way the program is structured in sort of the mandatory spending, it's based upon a formula that was developed in 1996, and so every year the share of spending in the mandatory side of that program goes down, and you can see that the share of spending on the mandatory side has declined by 12% over the last 5 years. And meanwhile, in contrast, the share of spending on the mandatory side overall has actually increased by 6%. Yeah, so I'm sorry the charts didn't convert very well. In terms of education programs, funding has dropped by over $3 billion, or 7.5% since 2010. And then on an inflation-adjusted basis, it's over 15% drop. And the thing I also want to point out is that's just the federal spending. We know that most spending on public education is actually at the state level. So we would also note that the per capita education spending has decreased as well. And what I think this is a chart from actually Nate Silver at 538, and you can see that when the recession hit, the Congress actually did pass a stimulus package. And if you go back to the chart, there was the bump. And as the stimulus package has fallen off, and as we're coming out of the recession, what you can see is that state and local dollars actually went down dramatically. So the federal government helped fill in that gap. But as the federal share and the stimulus package, the money goes away, you can see that actually what we're not having happen is the state and local money coming back. So overall spending for kids in education continues to decline. And that is also happening on the early childhood side. If you look at a NEAR report recently about the average state spending per child enrolled in early childhood programs, you can see a pretty significant decline over time in the average spending. And here is we're trying to drive toward high-quality early childhood programs. Reducing spending in them is actually having a poor effect on that. So where are we investing? So as you can see, we know Medicare and Social Security are big federal programs, and so we're putting a lot more resources at the federal level in for elderly than kids. At the state level, it's the reverse, as you can see. So the blue bars actually show that education spending in other areas are big at the state level, but at the federal level, this is the disparity, and it's actually growing. And I'm not trying to pit seniors and kids, but I do want to point out that money matters, and so this next chart really shows that. So as we took on the war on poverty in 1996, we actually did create the Medicare program and also expanded the Social Security program at that time. In contrast, what have we done for kids? And I think people know the TANF story. What we did is block granted it and froze it in place. So actually every year there's fewer dollars on an inflation-adjusted basis for kids in what is thought of as a predominantly poverty program. And in contrast, Social Security and Medicare have automatic adjusters. And so what has happened is more and more money goes toward that end, and you can see it works. So the kid number, these are the poverty rates by age, and you can see the poverty rate for kids has actually increased since 1968. And in sharp contrast, the poverty rate for seniors has declined dramatically. So it works, and it's been effective. And actually, if you think about, this whole conversation about what, the war on poverty, the 50-year anniversary, has it been effective? Overwhelmingly, it's been effective, particularly on the senior side, and this chart really proves that point. In terms of where we're heading, if the current policies, this is from a CBO projection of, if the current policy occurs over the next 10 years and we change nothing, we have utter gridlock, and we just have the status quo, this is the effect on kid spending. And so you can see there'll be a 24% decline over the next decade in terms of the share of kid spending as a part of GDP. And I would also note that the Urban Institute projects that in 2017, spending on interest on the debt will actually exceed all federal spending on kids programs combined. So I'll say it again. Spending on interest on the debt will exceed all federal spending on kid programs combined in 2017 unless we take action and change things. To move from the depressing to the more positive side, the good thing is voters are on our side about this. Voters believe that we should be investing more in kids. So we had a poll and we asked people, what do they think the share of spending for kids is? And they actually think it's about 18%, more than double what it actually is. And then we asked them what they want, and they asked for almost a third of the budget to be dedicated for kids. Now, there's a lot of reasons why we'll never get there, but I think that it's an important point that voters do think that there should be increased investments for kids. And you'll note that even back to the other chart, Tea Party folks do not think we should be cutting kids when we're reducing the federal deficit. So there is public support for kids. This is a poll that we've been asking every year since we started. And the question is in the last 10 years, how do you think kids are faring? And in the first few years, actually, people felt the lives of kids had gotten better. And then it sort of flipped when the recession hit. And what you can see is now it's overwhelmingly people think the lives of kids are worse off in the last 10 years. And so by a 57 to 13% margin, people believe that the lives of kids have gotten worse rather than better over the last 10 years. And then we ask them about the follow-up question is, what do you think kids' lives will be better? The next generation's lives will be better than ours? And for 100 years, this has been that's been sort of the American dream, which is every generation is better off than the past generation. And this is when this recession hit, it flipped. And you can see it's now overwhelming. People think that the next generation will be worse off and that the American dream's threatened. And so one of the things in talking to pollsters about that is that's our hook with voters. They're deeply concerned. They do not like this. It troubles them as they worry about our nation's future and our kids. And this is an area where I think is something to really talk about. And David Konevsky is going to be here later to talk a little bit about this and some of the polling he's done on the issue. In fact, this is from his poll. And kind of some of the advice he has for this. But I will point out something there is that with Republicans, it's 18 to 80 that they are not confident. So they're the least confident about this. And it's, you ask the follow-up question, and they're very concerned about that. This is from Frank Lunt's poll that we did several years ago, but I think it still stands. And he is a Republican pollster, and he tested this message of, what's the urgency to people. And so this message of, if we want to ensure that the next generation is healthier than this one, if we want to leave our children better off than our parents left us, we cannot wait any longer. We have to act now. And you can see by 84 to 13% margin, people agreed with that statement. And I think that one of the things that Frank would say about that is we're kind of at that point in the pollster world where about 25% of people hate everything. So the fact that half of the people who hate everything actually agree that we should do something for kids is pretty phenomenal. So the 84% number is great, but that 13% number is phenomenal, actually. So what are the 4 things we need to be doing? And we're going to do a poll here in a few minutes, but there's 4 really major steps. And I think in terms of where we stand, some of these things we do really well, and some of them we, as a community, a child advocacy community, we don't do as well. But first is raising awareness, sharing knowledge, data. Second, developing policy. Third, building will. Fourth, taking action. So I'll talk a little bit about each of those. Raising awareness. Certainly today's event is one of those things. And Hill briefings, the reports all the organizations in this room put out, and the conversations we have about issues that are important to kids. And so whether we're talking about the importance of brain development or the importance of investing in education, et cetera, those are all around raising awareness and getting the public to understand our issues. I will tell you a real quick story is when Frank Luntz was doing a focus group with us in Des Moines, Iowa, he asked people in the audience, name your biggest issues. And people talked about, at that time, things like Iraq and Afghanistan and the war and the recession and unemployment and on and on and on. One person mentioned education, but other than that, no kid issues were raised. So he asked people, well, raise your hand if you're a parent, keep raising your hand, and if you're a grandparent. And so most of the room was either a parent or a grandparent. And so then he said to them, so you don't like your kids? You don't care about them? And people came unglued. And he's like, don't blame me. You didn't say it. So, this is your fault. Why do you not care? And what the issue was for people is they didn't see the connection. They didn't understand. They understand parks and schools are important to kids. But so when you would raise issues to them and he'd say, the Children's Health Insurance Program is actually a federal program. So you should care about that. Is that important to you? And people were like, absolutely. And so what he talked about it in terms of we have a scratch and sniff issue. So raising awareness around it is important to get people to understand that connection to their concern for kids and what policy means to them. The next thing is around developing policy. This is something that's near and dear to my heart, because when I was on the Hill, I can't tell you the countless times people would come in to me and talk to me about horrible things about kids, and they had me. And then they would say, well, thank you for your time. And I'd be like, wait, please give me an answer. And they would walk out. And so I think when we go in and talk to Hill staff, we must not only tell them about the problem and make the problem statement, but also tell them what they should do and think about as a policy answer. And this is also, I think, interesting. We basically sampled a bunch of issues during the last election. So this is in 2012. And it was on election eve. And we asked people this sort of set of questions and tested people. Here's a set of kids' issues. What do you think about them? And what pollsters will tell you, if you have a strongly support of over 40%, that's pretty awesome. So and the environmental community can tell you that's their problem right now, is that strongly support on this. People care about the environment, but not intensely. And these numbers, our pollster on this was like, whoa, that's unbelievable. And even things like adopting a bipartisan commission on children, like who's like strongly crazy about that? But you can see the intensity level is 62%. So people strongly believe in all these things. And it was really nice to see. And of course, we believe there should be a adopted children's budget, and even that had 51% intensity. So even very technical things, not just important program things like CHIP or extending child tax credits, which have enormous intensity as well. So the next thing, of course, is building will. So we have the public on our side. We've informed people, but things still don't happen. So what are we doing wrong there? Some of the issues there is the way we talk about issues. Right now, there's a crisis on the U.S.-Mexico border about kids flooding in to our country from Central America. So the other side talks about building fences and walls and deportation and enforcement measures, et cetera. Unfortunately, on our side, some of us talk about unaccompanied alien children. So we talk about UACs. And it's like, really? So really, we need to really always think about the way we talk about things. And these are kids fleeing violence. They are refugees. They are children. And so we shouldn't talk about them as UACs. It dehumanizes them. And so these are some of the things that we had done some work with Drew Weston, and he talked to us about really connecting with people on their core values. And so this issue around the American dream is one of those, but here's some other words that he think are really important that really link people and their values to the issues we care about. Last is certainly building wills, is finding champions in Congress that are great for and having them speak out for kids. So we had Congressman Doggett here today, who's an example of that. Certainly Senator Murray had in the past year had, I believe, the first budget hearing on children in years, and also just always is a champion. And there's a set of those people, and we need to continue to build that and make sure that they put kids in first and foremost. We were in a roundtable conversation recently with some senators, and they were talking about, well, people don't talk about kids. Like, we can go weeks without people talking about kids. You guys need to do something about that. And I think they need to also understand that they need to do something about that. They can raise the issue so that there's a conversation. Last, taking action. That's all the other work we do around coalition building and reaching out to grassroots, et cetera. And really thinking about how to kind of create a window of opportunity. So that's supposed to be a window that's raised, and so our issue can go through. So. And also, we need to celebrate wins. So the Children's Health Insurance Program passed in 1997 and came up for reauthorization in 2007. President Bush vetoed it twice, so there was a lot of awareness around it in 2009. When we polled on this issue, it was 82-10. And again, back to the 25% of people hate everything, we had more than half of the people who are haters who were on our side. But that number slipped. And part of that is that people don't really necessarily know about the program. So we need to always be educating people and celebrate wins. It is wildly successful. People need to know that story. Home visiting is coming up. We need to talk about the importance of it, celebrate that it's been passed and the successes of it. So those are just examples. So anyway, so we're going to have a little test here, a little survey. So So what I'd love to do is get from people. I have my opinions on what of these things we do well and what we don't do well. I think it'd be, and what I'd love to do is provide everyone feedback too, but to ask people to send me an email. So you have my email at the bottom, and put in the subject head "Invest in Kids" and and on a 1 to 10 scale, tell me, and I will again. Anyone who sends me, I'll tell you what the final numbers are on this. Is how do we do on awareness as a community? Not First Focus, but all of us. How do we do on developing policy? How do we do on building will and taking action? Again, I have my opinions on which of these we do well and which we don't, but it'd be really good as a community to really think about that, and I'll get back to you on each and every one of you on what we all think as a community, and I think it could be really interesting to see. So if you just put awareness, give me a number, policy a number, will a number, and action a number, and we'll compile that, and in the next day or so we'll send you an email about what people are saying about that, and might even have a few thoughts about it, and maybe some messaging that we hear from David today about maybe ways to address some of those issues. So I'll give people a few more seconds on that, and then last I'll leave you with this. And is Ron here? Pardon me? Partner panels next. Okay, so you guys are ready. So anyway, I can take any questions from people about some of the findings in the report, if anyone has any. Yes.
I have a question about some of the survey information. Is there a minimal number of samples that you guys require for your data, or is it each one depends? And what is an average sample size for saying that a number is dropped by so much percentage, or polling?
So in the polls, I mean, the poll we do sample size of like 1,200 nationwide, which creates a. But in the book, that number is straight from appropriations bills, CBO. We call the committees, we bug them, we talk to the agencies. So it's how much money is actually being spent. And so we'll talk to the agencies to really get how much money were spent. So every year when we do our book, if you go back and look, the actually numbers in the prior year actually change some, because what is projected and what actually happens. So we have numbers right now for 2014. Well, those are projections on Medicaid, for example. And so next year when we do our budget book, we'll actually go back and adjust some of those numbers. So every year we sort of actually redoing 2 years. We're redoing the current year and the next year, and then also looking at the president's budget proposal. So it's a combination of all those things. That you're talking mostly about the book, right? Any other questions? All right. Well, and if you have any, yes.
Thank you, Bruce. The ECD, the Early Childhood Development Community, seems to have enjoyed some notable advocacy successes over the course of the past year in New York City.
Mm-hmm.
At the federal level, with the president mentioning ECD for the second time in a State of the Union address, and I think in San Antonio, I don't know the facts, but the mayor there,
yes, Mayor Castro, yeah,
Mayor Castro,
mm-hmm.
Winning a political victory to get a couple of cent increase in the sales tax to support
dedicated for early childhood.
Yeah. To what do you attribute the elevation of the political importance of ECD?
Mm-hmm.
I know it's a long time coming, and an immense amount of work has gone into it, but are you in a position to pull out a couple of the advocacy lessons from that one set of interventions for children?
Yeah, absolutely. So I think it's this framework here that I'll speak to, and it's so if you look at sort of the Children's Health Insurance Program, right? So there was a long time campaign to educate people about the importance of having coverage for kids, to the point where that was no longer the question. So then the question became okay, what do we do about it? So then you had to have a policy, and you had to build a will around that. So at the end of the day, Senator Hatch became a huge leader of that issue, worked with Senator Kennedy and others, had a bipartisan, passed it. And then, of course, and now I'm talking about how we need to keep working on it, because we need to in the take action stages, celebrate the win. And we're about to come up on it again. I think for early childhood, it's exactly the same thing. For a long time, we really had to educate people about the importance of brain development, the cost benefit, the return on investment, all those things. And people are now there. People get that that's a thing, and that as a nation, we should be doing something about ensuring high quality early childhood programs for kids. But that was as you said, it was a long campaign, and I think you're beginning to see the fruits of that. And so, as Mayor Castro or the mayor of New York and Seattle, there's an initiative around early childhood. It's happening in states across the country. There's become an awareness, and people are now developing policy around it and building will around it. There's a campaign, one of the gubernatorial campaigns, where both parties this is a conversation about which way is the best way to do it, and awesome. So I think that's where we are, and even here, like you go up on the Hill, we're not having the conversation anymore about whether we should, whether early childhood is an important thing or not. And for a long time we were. So I think we're really moving down the pathway, and it's sort of moving through the stages. And I think that's the lesson is we've done the awareness building side, and we're still at the federal level, we're still in the second, third, and fourth stages that we're going to have to, it'll take a few years, but we have legislation out there, big bills. There's Senator Murray's got a bill, Senator Harkin's got a bill. There's a number of bills out there, and we're beginning to have that conversation. The president's put out a proposal. The question is once we start having that bipartisan conversation about the need to actually take action, and that's the next step. Other questions?
Hi.
Oh, I'm sorry. I'm sorry. Okay.
I was wondering if you assumed any impact of the Affordable Care Act. A lot of the, whether true or not, reductions in 2015 in the president's budget are for discretionary programs where there's an assumption that third-party payment will at least replace the need for some of the public dollars. That hasn't been proven yet. But I was wondering if you did any assumptions around the ACA.
The ACA is actually hard to measure at this point. Like, we've done some assumptions on the 2014 budget. We have some increases. For example, the Medicaid expansions that have occurred in some states. That's really reflected. If you think of kids would actually be so much worse off in this year compared to last year if not for Medicaid and CHIP. Those were two of the biggest areas where there was actually increases. I will point out that when states do the Medicaid expansion, it's by and large adults, but there has been some kid expansion there. And so as states have done that, there has been some increase in spending for kids in those areas around the ACA. But I think that will be something that in the coming years, you'll see more and more of those numbers, spending in the exchanges, et cetera. That's really happening this year. So next year, you'll really see that reflected in our budget book. Yes.
Hi, my name is Linda Homburg. I work for Family Voices. We represent the 1 in 5 families in this country that have a child or children with special health care needs. And, this is a great job. It's always hard to get all the programs. One very, very small program that's missing is the Family Health Information Centers. There's one in every country. One in every state. I wish one in every country, one in every state. And they really help the families of children with special health care needs navigate the health care system. So I'm sure there are other programs. It's really hard to capture them all, but I did want people to know about it. And it might be interesting at some point, again, it's hard to cut the pie in different ways, but it might be interesting to try to see which of the programs that really do focus on our most vulnerable children.
Yeah, no,
and not have it, segregated throughout this book and have one section just on children with special health care needs. Thank you.
No, absolutely. And I'll point out it is captured, but it's part of the maternal child health line because it's in the way it's set up in the federal budget is it's part of that line item. So it's in that line item, not broken out though, right, Jared? Is that correct? Yeah. So right now it's captured, but it's in a bigger, broader line item, which is just how it is at the federal level. So, but I appreciate also your thoughts on the, trying to think about a pull out just on kids with disabilities. So anyway, I think I'm out of time, but I will, we're around any of the First Focus staff. If you have any other questions.